Hi, this is Deanna Harris. This video is for Nursing 224 for bed bath and occupying bed linen change. This here is my assistant for today. Can you let them know that you are over the age of 18?
Yes, I am.
And that you give me consent to videotape?
Yes.
All right, so we'll go ahead and get started with the simulation. Hi, my name is Deanna. I'll be your nurse for today. Can you please state your name and your date of birth?
Yeah, August 10th, 1981.
Okay, great. So I'm going to just verify the physician's orders to go ahead and give you a bed bath and to change your linen, okay? All right, so I'm going ahead and provide us some privacy here. And the reason why we're going to go ahead and do the bed bath and change is to help prevent the spread of any bacteria. And during the bed bath process, I'll go ahead and assess your skin for any skin breakdown, any new skin changes, okay?
Right.
Do you have any questions?
No.
Okay, and do you have contacts? Do you wear contacts?
No.
Are you okay with me giving you perineal care?
Yes.
Okay, and you can lay flat and you don't have a DVT. So I'll go ahead and get started. I'll raise the bed up to a hip level. I'll also put the patient in semi-Fowler's position, at least 30 to 45 degree angle. I'll go ahead and perform hand hygiene and don clean gloves. All right, I'll provide the patient with a bath blanket. Oops, sorry. Okay. Go ahead and hold on to that, and I'm going to go ahead and take the sheet down here. I'll make sure that I have the linen reciprocal near me. You never want to put this in the trash. Or on the floor. Yeah. All right, so patient has the bath blanket on. Now I'm going to go ahead and remove the gown. Help assist with the gown. Okay. Take the arms out. Okay, now I have taken off the gown and put that in the appropriate reciprocal. I'll go ahead and move the patient's pillow and replace it with a towel. Okay. So next I will go ahead and have my warm soapy water and warm just regular water. I'll go ahead and start with the eyes. And I will start with the innermost part and wipe out. Take another part of the washcloth, innermost part and out. I will go ahead and then dry that area. Okay, and then next, do you want just regular soap and water or just regular water?
Regular water. For
your face, okay. I'll go ahead and just take this and do the forehead, the cheeks, ears, nose, mouth, chin, and neck area. Then I will go ahead and dry those off. Dry that area off. Next, I will go ahead and do the arm. I will go ahead and place a towel underneath the patient's arm here. There we go. I will take the warm soapy water, starting at the fingertips, and long, smooth strokes up. Then I will take the warm water, rinse. I'll make sure that I'll get underneath the underarm area. Rinse. With soap and water. And then I will rinse. Next, I will go ahead and dry that area. Okay. I'll go ahead and put the side row up on this side. Go on the other side. Take the side rail down and do the same thing on this side. Place a towel underneath. Go ahead and get the soapy water. soap here. Have the patient to put over top of his head. Wash under his underarm. Take the clean water. Do the same thing from the fingertips on up. And then we will dry. Next, I will go ahead and let them know I will go ahead and do your chest area. So I'm going to roll down the bed bath just up underneath here and expose just his chest. I will make sure that I will take the washcloth, the soap washcloth, and I will go ahead and make long, smooth strokes down the chest area, making sure I get the folds, the umbilicus area, and if I had a female, I would make sure that I'll lift the breast individually and wash underneath. I will go ahead and then rinse and do the same, making sure that I will rinse the folds, rinse the umbilicus, and underneath each breast. Then I will go ahead and dry, making sure that I will dry each area, the umbilicus, the breast, and the folds. Then I will go ahead and put this back up on my patient. And then next I will go down to the leg, just exposing the leg portion. Making sure I have a towel underneath my patient. I will go ahead and take the water, the soap and water, and I will go start from the ankle and work my way up. If the patient had a DVT, I'll make sure to apply light pressure in that area. I'll go ahead and rinse and dry. Next, I will get down to the foot. Take the soapy water, the top of the foot, in between the toes, the bottom of the foot, lift to the heels, making sure that there's no pressure ulcers there. I will rinse, and then I will dry. In between the toes, bottom of the area. Then I will go ahead and put the bath blanket back over my patient, pull the rail up, go on the other side, and do this side. Just exposing the leg, making sure that I have a towel underneath him. Okay. And then the soapy water. From the ankle on up. And then just the regular water on up, from the ankle on up to the thigh. And then I will dry. And then I will take the soapy water again, do the top part of the foot, in between the toes, underneath the foot, assessing the heel for any pressure ulcers. I will rinse in between the toes, and then I will dry. I will go ahead, put that back over my patient, grab all my towels and my washcloths that I've used so far, and put those in the reciprocal. And then I will take these gloves off, perform hand hygiene, put more clean gloves on, and I will go ahead and get new sets of washcloths and everything. I will inform the patient that I'm getting ready to expose your perineal area. Okay, so I'll go ahead and expose that area. All right, and I'll also put a chuck or something underneath just to catch any water. I'll go ahead, use the soap and water, clean the inguinal area first. Take another part of the washcloth, clean the other side. Then I will rinse. And then I will dry. Next, I will go ahead and take, since he's a male, take the shaft of the penis to hold. I will go ahead and start at the urethral meatus and turn clockwise from inside out. And go ahead and clean, and then I'll take the shaft and go downward, and then I'll take another part of the washcloth and do the scrotum area. Then I will rinse. And then dry. All right. All right. You okay?
Mm-hmm.
Okay. All right. So now I will go ahead, empty this water, get clean water, clean soap, take my gloves off, perform hand hygiene, and then don new gloves again. I will go ahead and have the patient to turn on his side so I can get to his back. All right, and then I will use the soap and water and long smooth strokes down the back area, the buttocks area. And then I will go ahead and dry this area, or rinse this area, sorry. Rinse. And then I will dry. All right, I will assist the patient back over on this side. Okay. All right, so now I will go ahead and empty the water basin. I'll go ahead and clean it with water and dry it. I'll go ahead and take these gloves off and perform hand hygiene, don clean gloves, give the patient a gown. So we'll go ahead and put the gown on. Okay, so now the gown is on. I'll go ahead and take this towel from up underneath the patient, put that in the proper reciprocal. And so now what I would do, if it was just complete, I will go ahead and take the bed bath from up underneath the patient. I'll just leave it on you. Up underneath the patient and put that in the proper reciprocal. But since we're going to go ahead and do the bed change as well, I'm going to go ahead and keep the bath blanket on. I will go ahead and have the patient to turn to his side with the bath blanket, making sure that it's not going to expose him. I will take the fitted sheets and the old sheets off. There we go. Roll it to the midpoint. There. And then I will go ahead and put the new fitted sheet on halfway. I will also have a drape, and the drape will have the closed side being close to the patient's shoulders, the open side towards the bottom of the bed. And this is halfway here. And then I'll also put a wet pad over top of this. Okay, and then I will assist the patient to come back over on the side, go over the little hump there, there you go. I will come back, I will lift the rail, side rail up. I will come on the other side, put this side rail down. I'll have the patient to roll over on this side here, and I'll take all of the old linen off and put it in the proper reciprocal. And then I will go ahead and pull the new linen through. There we go. You okay?
Mm-hmm.
All right, now I'm going to assist you back in a supine position here. Okay, so now I'm going to give you a top sheet. There we go. All right, so now that the top sheet is on, I'm gonna go ahead at the bottom and take the bed bath blanket from up under the patient, taking it away from me, making sure that I put it in the linen reciprocal. I will go ahead and bring this down over the patient's feet, but I will make sure that it's not tucked so tight that the patient couldn't move their feet. You okay? You're comfortable? All right, good. So next I will go ahead and take the patient's pillow and take the pillowcase off. And I'll take it off like this and pull it off. And then once I pull it off, I'll get a new pillowcase. And what I will do is I will scrunch up the pillowcase like this, making sure that I put the pillow inside without it touching my uniform, and making sure that it's all covered. Okay, sir. There you go. Yeah. Now that should complete the whole bed bath and changing of your linen. We got your gown on, and I will go ahead and just reassess your pain. You're not in any pain. Are you tired? Okay. All right. And then, is there anything that I can do for you?
No.
Okay. I just want to try to keep you comfortable. So then I will go ahead and take these gloves off, put them in the reciprocal, make sure that the side rails are up, perform hand hygiene. Then I will come and make sure that the bed is at the lowest position, that the call light is reached, the bed is locked, and making sure that you are okay.
Yes.
All right. And then I will go ahead and perform hand hygiene and exit the room. And this will conclude bed bath and changing of the linen of an occupied patient. Thank you.